What's up, everybody? How we all doing out there? My name is Jack, and this is Rate Your Pain 1 to 10. I apologize I haven't posted in a little bit, but I wasn't feeling too well last week, so I kind of had to put things off and postpone an interview. But we're back, and we have our first interview for you. So I'm really excited about this. I hope it's the first of many to come, so let's get right to it. All right, welcome to the show, Andrea. If you'd like to please introduce yourself, give us your location and your disability, tell us how long you've had it. We'll start from there.
All right. Well, I am Andrea Miller. I will be 36
You don't have to give your age.
next week. And I have RSD, reflex sympathetic dystrophy, also known as complex regional pain syndrome, or CPRS. And this is my 16th year with it.
It's a long time.
Yeah.
I'm going on 7, and that's seems like half my life already. So
yeah, pretty much my whole adulthood.
Wow. So I think you told me before, like, since you were 21, right, when you got it?
I was 20.
20. Gosh.
Yeah.
That's rough because, my 20s were my best years, so I couldn't imagine having to live through my whole 20s with it too. I mean, I got it at 30, and I feel like that's still young. So
yeah.
So why don't you tell us?
Changed my life.
Yeah, no doubt. Go ahead and tell us about how it happened, the story of what caused it, your injury, and the aftermath.
All right. So I had just moved to Kansas for a dumb boy. And I was meeting my family here in New Mexico for Christmas. And I just gotten to my grandparents' house where, my cousins were, my parents, my sister were all at. And I was putting my stuff away. And my cousin, we're like brother and sister. He just straight up, like tackles me like, hey, missed you. And roughhousing on the bed or whatever. And I fall and I brace myself with my left arm. And, he just keeps pushing, not thinking about it. And, we just fall to the floor. And I'm like, that freaking hurts. Not thinking really anything of it.
Right.
And then, the next day I'm, changing my clothes and I couldn't lift my arm like above here without like excruciating pain. Everybody's like, oh, you probably just pulled a muscle, no big deal, just take it easy. Well, 2 days, 3 days go by and I still like can't do it. I'm like, something's seriously wrong here.
Right.
And so Christmas Eve, I go to urgent care and my elbow's fractured.
Oh, wow. So you waited that long? Wow.
Yeah, I waited, about 3 days. So I went to the doctor. Because I was like, Mom, I can't even like brush my hair, it's, something's up. So they put me in a full arm cast, a hard cast, because I was traveling.
Mm-hmm.
I was in that cast for about 6 weeks. And then when they took me out of it, my arm was completely stuck in a 90-degree angle.
Oh.
And my hand was cupped like this, because you've got the cast and the little hard part there. So my arm's completely stuck, my hand's cupped, I can't move it, my shoulder's frozen, I couldn't lift it above like chest level. So when I was in Kansas, the orthopedic, sent me to physical therapy, gave me some more pain meds,
Mm-hmm.
The normal Vicodin.
Typical, yeah.
So then in physical therapy, they, were working my arm, it's hurting like hell. Then they put my arm in an ice bath.
Mm-hmm.
Which,
the contrast bath.
Yeah. So they just, stick my arm in this tub of ice, 20 minutes in, 20 minutes out, 20 minutes in, 20 minutes out. I'm driving home and then like I just start bawling like hysterically because it hurts so bad. Like I just can't even like see. So I just turn around, go back to the hospital, go to the emergency room, and the nurse taking me in, she's like, oh, there's nothing wrong with you. Just straight cranks my arm straight. She's like, you're 20, you just want drugs, you're a drug seeker. I'm like, no, really, like something's wrong with me.
Yeah. They always start with the drug addict thing, Exactly. We don't want it if we don't have to.
No. So So I went back to the orthopedic, right away. And, I'm in like some podunk town on the Kansas-Oklahoma border,
Oh,
still
yeah.
segregated,
Right.
he automatically diagnosed me with RSD. So I look
Really?
it up. Yeah. So this is
That was
probably,
quick.
yeah, literally like 8 weeks from the initial injury, I'm diagnosed with it.
Wow.
Yeah. So I looked it up online. I'm like, this guy's crazy. Like, what is this? Like, nobody knows what this is. I've never heard of it. And so, we just kind of go with it since, there's no big hospitals or big doctors where I'm at.
Right.
And so he just pumps me full of drugs. I'm taking Neurontin, amitriptyline, morphine, dilaudid, hydrocodone, oxycontin, Vicodin, fentanyl, Flexerol,
All of
baclofen,
them.
all of them.
Yeah.
Just trying different combinations, increasing the dose, lowering the dose. And, I just can't freaking think anymore because I'm just so drugged up on everything.
Zombified.
Exactly. Um, so since things aren't getting any better, um, they're actually getting worse. I'm feeling, like my arms burning on fire from my fingers to just like right above my elbow.
Yeah.
I can't touch anything. I can't move. Like like the slightest breeze is like
I
making
always say that
pain.
a breeze
Yeah,
will do it.
yeah. And my boyfriend at the time's like, you must be making this up. Like, you just broke your arm. Like, what is this?
Oh, even your boyfriend. Wow.
Mm-hmm. Like, I couldn't even take a shower because just like the water from the shower touching my arm was just
Mm-hmm.
like painful.
Yep.
So, I'm having to take baths. He's having to help me like wash my hair because I can't, make my arm go up.
Right. Yeah.
Um, so then I get a referral to a doctor in Tulsa, and he's a neurologist, and they're talking about a spinal cord stimulator. So we do the trial, and basically what a spinal cord stimulator is, for everybody who doesn't know, is they put a battery pack into either like your hip, the back part of your hip, just above your butt, or in your stomach, depending on, which extremity it is, if it's your arms or your
The
legs.
availability of location kind of.
Exactly. And then they run a wire up your spine and they connect these electrodes to your nerves in your spinal cord. And they send electrical signals through your nerves to kind of like block the pain out, basically. And so we do the trial one. So I have like a wire sticking out of my neck attached to a battery. I can't like move my neck. I'm in a neck brace.
It's rough. How'd you like that?
Oh, it was amazing.
Really? Because I've been too scared to try them. They keep trying, and it
Oh,
freaks me out.
so the trial worked perfectly. My arm had no pain whatsoever. I mean, it was just annoying having to carry this wire out of my back and stuff.
Yeah.
So then, we scheduled the surgery. I wake up, I'm sore because they pretty much take this long turkey baster and shove it all the way up your back to get the leads in
Ugh.
to connect them. So I have a scar, about this long on my hip, a scar this long at the base of my
Mm-hmm.
neck.
Wow.
And he's like, okay, it takes a couple of weeks for you to, get over the feeling of the surgery, da 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 da. I'm like, okay, cool. So it's like 3 months and it's not helping.
So the trial worked,
The trial worked
but
perfectly.
the permanent one did not.
Nope.
Oh my God.
I,
See, that's what I'm afraid of.
and he took me off all of my meds.
Oh my God. So
But
you're
this
just
was supposed
suffering.
this yeah. So I go back, for, a follow-up appointment. I'm like, it's hurting. So they call in like the Medtronic rep person to change the settings. Nope, not doing a thing. If anything, I'm feeling worse.
Mm-hmm.
Not because I'm not on pain meds, but because the pain's now going up to my neck.
Wow.
And
So it's just spreading.
your nervous system is pretty much like a mirror image. Like, so what happens on your left side, your brain kind of thinks, oh, it's happening on this side, it should be happening on this side.
Mm-hmm.
So then I start getting pain on my right arm.
Oh my gosh.
And like I said, I go back again, another month later for another follow-up. I'm like, can you please like put me back on my medication? He's like, you know what? You just got to learn to deal with it. Go back to work, get a job. I'm like, are you freaking kidding me? You want me to work? Like, I can barely like stand.
Yeah. I mean, you're worse off at this point.
Exactly. And then my back's hurting because, the wire's up there, so it's like tight. And then eventually, as things settled in place, the battery pack settling, I'd get out of my car and I'd just straight collapse to the floor because it was pushing on something like a nerve or whatever in my hip.
Nerves are powerful.
Yeah. And, my leg would just go out.
Wow.
So needless to say, I went back to my primary doctor and I was like, I'm turning this thing off. This guy's refusing to help me. Can you please help me? So back on all the drugs.
Yeah.
I mean, not that I wanted to be on them, but this pain's like so horrible and it's spreading.
There's no choice at that point. I mean,
Yeah.
there's the thing with RSD is treatment never ends. Even if you find one that works, you always continually have to have something, whether it's drugs or some device or injection or whatever. The treatment never goes away. And
And
yeah,
one set of drugs will work for a good 6 months and then you get used to them. So then they stop working. So then you either have to change the combination, change the dosage.
yeah,
But, and this is all before, the whole war on drugs, prescription drugs thing. So,
right,
you know,
right. Okay, so they were
they're like,
just feeding you drugs.
yeah. Like I said, I was on morphine and Dilaudid at the same time.
That's unheard of. I mean, that's
And,
crazy.
all these other ones. And then, so at that point, I just fell into like this crazy severe depression state because, nothing's working.
Yeah,
I didn't get out of bed to except to use the restroom for like 6 weeks. I didn't
yeah.
eat. I didn't shower. I didn't do shit. Sorry.
It's okay. You can say that.
um, and, my parents are all the way in California. I'm in Kansas. So I flew out for Thanksgiving and they're like, just come home. There's
Yeah,
better doctors here.
yeah.
Stanford, there's UCSF. So that summer I moved back home and over in San Jose, I saw another neurologist, an orthopedic, and a pain management specialist just to make sure this was like the right diagnosis because
Mm-hmm.
we still thought this guy was a quack.
Right.
And they all said, yep, that's what you have. And the thing about RSD is there's no definitive test to
Right.
say you have this. It's basically a process of elimination.
Mm-hmm.
Doesn't show up on an X-ray, it doesn't show up on an MRI, a CT scan. There's no blood test. It's you don't have this, you don't have this, you don't have this, you don't have this.
Nothing.
See what you have.
Just symptoms to go off of.
Exactly. So when you go into the emergency room and they see nothing's wrong with you, they're like, you're crazy.
Yeah.
I don't know how many times people have said I'm making it up or making it seem like it's this big deal when there's nothing wrong with me.
Discrimination is huge with a lot of chronic pain, but I mean, especially when we're young and we have a invisible disease. Yeah, you're young and you should be fine. I've said it many times, people they look at you and because they don't see it, therefore in their mind it doesn't exist. And
Exactly.
it's just an unfair assessment.
Yeah. And, I can understand, well, I can understand, people that don't know me, like on a personal level, being discriminatory against it or against me, but it hurts even more when it's your family.
Yeah.
My sister didn't get it. My cousins didn't get it.
Uh, and that's your biggest support system. That's who's supposed to be there for you.
Exactly. So once I was back in California and saw those other doctors, I eventually got a referral to Stanford. And through this whole process, what was keeping me going was I had found a support group online, and we all still talk to this day. Is pretty much
That's cool.
the very first support group online for RSD, and I connected really well with a friend, Kate, in Australia, and she was getting ketamine infusions. It was still, a trial thing, but
Mm-hmm.
over in Europe and Australia, it was more common than here in the
Right.
States. The doctors in the States were actually having to go to Mexico or Germany to perform this.
Yeah.
And back then it was more of a coma treatment, being put into a ketamine-induced coma.
Mm-hmm.
Um, so when I went to Stanford, I was like, maybe they'll do it. I've tried everything else, nothing's working, and they weren't up for it at that time. This is, like I said, over 15.
Right.
Oh. So, they tried nerve blocks, they tried other types of infusions, lidocaine infusions, again, changing up the medication.
Mm-hmm.
I was in intense physical therapy 3 times a week where I had to double up my pain meds before going because
Right.
it was torture. But, the guy was amazing. He didn't care if I cussed him out the whole entire time. But, I got full function of my arm and my hand again.
Yeah, that's great.
So Stanford wasn't on board with the ketamines infusions, but they did give me oral ketamine, liquid form, and I took that for 3 years, and it helped a lot. But still, I couldn't, really drive when I was taking it, so I
Right.
kind of plan things out or get a driver.
How did
'Cause,
it make you feel? Like
um,
foggy or?
so there's a few different ways that you can take it, and I always took it liquid. Um, and it tastes like shit.
Mm-hmm.
But like the first 15 to 20 minutes, you do get like a really big high, like you're drunk.
Okay.
So you're kind of like stumbling a little
That's what I've
bit.
heard.
Sometimes like if you take too much, which working with a syringe is always a possibility, because you're taking such a little amount.
Oh, so
The
you.
dosage is so high.
Mm-hmm.
It was pretty much like 50 milligrams per cc, which is like a drop.
That's yeah. Right.
So, if you don't have that line right at the marker, you're going to get a little bit extra.
5 cc's, I think, is a teaspoon. So for people to imagine out there, that's 1/5 of a teaspoon.
Yeah.
So
So I was taking 2 cc's every 2 hours
wow.
because it doesn't stay in your system very long.
Mm-hmm.
Um, so for the first 15 to 20 minutes, it's best to lay down because you're going to be stumbling all over the place.
Right.
But it did help, which made me want to try the infusions even more,
Right.
even
Yeah.
the treatment, because, like I said, it was pretty much my whole upper body at this point. So my mom found a doctor in Florida who was doing the coma treatments in Mexico. So we flew to Florida
Wow.
and met with him, and he was pretty much like, you were able to make this flight out here. You're not bad enough.
Oh, no, you're that desperate is what it is.
Exactly.
Come on.
I'm like
Oh my.
22 years old at this point. I don't want to be stuck in bed,
I'm not coming
like,
out here for spring break, buddy.
right?
Oh
I'm
God.
like, I don't want to get to that point
Right.
where I'm too bad. I want to prevent myself from getting to that point.
Exactly.
So I was like, sweet, trip to Florida, waste of time.
Ugh.
And so we went back home, and we kept searching and searching and searching for somebody, and we found a doctor in LA who did infusions in the States, in LA. It wasn't a coma, but he did them.
That's
So
what
I
matters.
emailed him, I talked to him. He was like, he's like, what have you tried? I'm like, here's the 10-page list of drugs. Here's, the list of all the procedures I've had done, all the injections. He's like, perfect candidate. Send me your medical records, get some blood work, come down here next week. I'm like, dang.
Sweet.
The only thing is we had to pay cash because
Yeah, no insurance would cover it if
insurance
this.
wouldn't cover it.
Yeah.
Because especially back then, it was super experimental.
Well,
Um,
insurance companies are very strict on what procedures they cover for what conditions. So
Yeah,
even if they covered ketamine infusions, RSD probably wasn't on the covered list at that time for the infusion. So I face
exactly.
a lot of that with my procedures and medications, and so
Yeah. So me and my mom, we made the trip and did a little sightseeing beforehand and went in 6 in the morning. Hey, how's it going? Let's hook you up to the IV. That was it,
wow, just right away.
just right away. Um, Now at this point, I'd been taking the oral ketamine for 3 years already.
Right.
So I had a
I
tolerance.
was gonna say, yeah.
He hadn't had a patient yet who had been on oral ketamine, much
Oh,
less for that long.
so
So
that was a challenge for them.
yeah. So his baseline for his first patient, like your first infusion, is to start at 1,000 milligrams,
Okay.
and that's over 4 hours. So after the 4 hours, they wait till you can get up and get into the wheelchair, get into the car, and then you go home. So, about 6 hours in the outpatient setting.
Hmm.
And the next day he sends me an email. He's like, "You were still talking and having a full on conversation with me." He's like, "I've never had that." I was like, "What in the world? Like, you should have been
Yeah.
out and you're holding a conversation, knowing exactly what's going on." I'm like,
That's nuts.
"Oh,
Yeah.
really?" But the thing is that night I started having hallucinations because
Oh,
that is a big side effect of ketamine.
really? Wow.
Yep. And on the street it's special K, and that's you put yourself in a K house so you can hallucinate.
Right.
And
I remember kids in high school being into that stuff. Yeah.
yeah, so we're in LA, there's road work, there's sirens. I'm thinking I'm in a war zone, and I'm like army crawling on the floor, like in the dark. My mom's like, "What are you doing?"
That's
I'm like,
like,
"Down."
wow. That's
So the
bad.
next day, yeah. So the next day, he prescribed me some Ativan, so the hallucinations went away. Um, because they vary from person to person if they're going to have them and what kind of hallucinations they're going to have.
Right.
Um, but the drive home, my mom's like, "How are you feeling?" I'm like, "My pain's gone. It's gone."
Wow. After just one 4-hour treatment.
Just one 4 hour treatment. And
That's
so,
amazing.
yeah, like I was crying.
Yeah.
Like a car ride, normally I'd be in tears the whole time because every little bump just is agonizing.
Yep.
But this car ride, they were tears of joy.
Wow. That's
Um,
amazing.
so that first infusion probably lasted about 6 weeks,
Okay.
full remission.
Wow. For just
Uh,
4 hours. That's
yeah.
crazy. I
And
got to get on this because I've been wanting to do more research before I do it, but there's a year waiting list when I went back in December, so they want to get me in earlier if they can, though. But it's just a matter of me making the call and really making
yeah,
it happen. So you know, I need to get
might
on.
as well put on the list if it's that long.
Yeah, there is.
You can
So
always cancel.
yeah, yeah.
But so, after the 6 weeks, we scheduled another one. He upped the dose this time because I shouldn't have been talking and having a conversation with him.
Right.
Um, so the second one, instead of 6 weeks, it lasted 3 months.
Wow.
So we scheduled another one. This time he upped the dose again. Um, he upped me to double to
Oh
2,000.
wow. That's
He's
heavy.
like, "This is the most I've ever given anybody, and I don't know anybody who's ever gotten this much for this type of infusion."
Wow.
Um, but at that time I got 6 months full relief.
Now, did you have hallucinations at all after that first time when he upped the dose the next time
No,
around, or no?
no.
Okay, that's good.
Um, and then also after the infusion, he gives you oral ketamine to take twice a day for 2 weeks, just to kind of let it gradually get out of your system instead of
Okay.
just like all of a sudden.
Yeah, yeah.
Um, and I've been getting, well, was getting these infusions for 8 years. It was like clockwork. 6 months, I could gradually start to feel the pain come back. I'd give him a call, shoot him an email, be like, hey, let's schedule. He'd get me in within 2 weeks. So I
Wow.
never had to get like that full-blown RSD feeling again.
That's awesome. See, my concern with getting the infusions is like I can't work right now. I can't do much in life because my leg is just in excruciating pain from this. And
Yeah.
if I get the infusions, my doctor said it may last about 2 months at best for me, considering my condition or whatever. And if I'm close enough to Stanford that I can do that every 2 months, that's great. But the thing is that concerns me is now it's almost like a catch-22 because if I start getting them and I get better, I may be able to go back to work. But if I go back to work, I'm not some big Wall Street guy where I make a lot of money. You know what I mean? I'm a bartender and a chef. So, I mean, a chef in training because I never even finished culinary school. So
Yeah.
now I say I go back to work and then I get taken off of my Medicare and my Social Security because I'm working again. But I'm not making enough to pay $600 a month for insurance to cover these ketamine infusions. So then I get the infusions are now cut off, and then I'm back to where I was with RSD, and I have no benefits or nothing to help me anymore. It's kind of like a feedback effect, and so that's
Yeah.
my big concern.
Okay,
So
so before you got on disability and Social Security, how much a month were you paying for medication?
I wasn't actually. God, I was paying a lot, I guess. I was paying like around $300 a month, maybe, just for the medications.
Okay, so my infusions are $2,000 per pop. 1,000 for the doctor, 1,000 for the facility.
Mm-hmm.
If you're paying $300 a month, and I'm not having to pay for any medication for 6 months. 300 times 6 is almost the amount of an infusion.
Yeah, but that's if it lasts a full 6 months. Like they estimate about 2 months for me. So
But their protocol is probably different. They probably do it differently.
maybe, yeah, that I don't know how they do it. So
Because so now we're in New Mexico, and I had an infusion back in November. I haven't had to have one since I got pregnant with my son almost 3 years ago. It's
wow.
pregnancy, lucky for women.
I was gonna ask.
Pregnancy tends to put women into remission.
I
How
remember.
long it lasts, it varies. It could be till the kid pops out. It could be till they're done breastfeeding. In my case, he was almost 2.
Yeah, so it was almost 3 months or 3 years. Sorry, that you were in complete remission then, huh?
Yeah, I told your wife she was
Yeah. I wish I could get pregnant and get rid of it, huh? Yeah, it doesn't work that way, I don't think, though, but unfortunately.
Yeah, so the doctor here, he does ketamine infusions, but he does the inpatient ones where you're in the hospital for, 3 to 5 days, depending on what you want, and it's a low dose.
Yeah.
I told him how much ketamine I was getting in how short of a time, and his eyes almost popped out of his head. Like literally. He's like, what? He's like, that's almost in a coma. I was like,
Yeah,
well, hey, it's not a coma, so
it
it's still
works.
legal.
Yeah. Well, I'm pretty sure Stanford does low dose. That's what they told me. At
Mhm.
least I know they do a 4 or 5 day inpatient.
Uh-huh.
That they said is low dose, and then I think the outpatient is still low dose.
Mhm.
Maybe more than the inpatient because you're there for only 4 hours a day
Yeah.
for I think 4 days. But
So this doctor, he was willing to work with me. He gave me as much as he thought the hospital would allow
yeah,
per hour. So he was giving me 90 milligrams every hour, which is basically what I was taking orally at home when I took
right,
it. But it does have a different effect because it's going intravenously versus through the mouth.
right. More
And so
higher
while I was
bioavailability.
there for 3 days, you know, I was pretty much hallucinating the whole time because, you know,
It's nonstop.
It's stop. Exactly.
Yeah.
There's no, 2-hour break. It's going directly into your system. And
I
I
hate
wasn't
that.
able to communicate to him that I was having these hallucinations, so he couldn't up the Ativan.
Oh.
But basically, um, I got home and my pain came back the next day.
Oh no.
Yeah.
Wow. Wow.
So I talked to him and he's like, all right, well, as soon as I get some more ketamine, enough for you, I'll do it the way your doctor in California did it.
Okay.
So that was back in December. It's now July. I just saw them last week and he finally got some, enough for me at least. And
A whole order just for you.
yeah. And he's like, as soon as I get back from vacation, we'll schedule it and we'll do it your way. So thankfully, I have a doctor that's willing to go outside of the box and what he's used to doing.
They're rare to find,
Yeah.
My doctor I have right now, he's my pain management doctor anyway. He's amazing. And, like I was telling you before, he used to work at Stanford for like, I think he said 30 years. So he knows what he's doing, man. The first time I saw him, he was like, so are you experiencing this, that, and that? I'm like, yeah, exactly. You know what's
Yeah.
up. So, yeah, it's nice when you have that. Yeah.
Yeah. I'm just glad with this disease that I don't know if you've seen pictures of people with it. I don't think your legs get like that
Purple
either, where they get purple and they swell up
lesions.
huge. Like,
Yeah.
I don't know what I'd do if my arm got like that.
Yeah, and I
But
think that's what they call CRPS type 2, I think, where it's just so bad that, I mean, there's open wounds and, I mean, it's
yeah.
bad. So I'm very thankful I don't have that. I'm very thankful I do live driving distance away from Stanford, so
Yeah.
I know it could be a lot worse. But when it's yourself, you can't help but always feel like, you're the worst case there
Yeah.
is because it's
Exactly.
your life, so
Yeah.
in a sense you are the most worse off in your life because it's your life.
Exactly.
So um so I have a little game I want to play.
Oh boy.
Something I'm gonna try here. It's nothing serious, but so you've heard of the game out there that it's called like what is it? Mary, Murder, and the third.
Yeah.
So this is kind of like a take on that, but it's called Infect, Detect, and Cure. So if you can
Okay.
infect everybody, the whole population, with one quality, like positive quality,
Mm.
what would you infect them with? Something that would make everybody better, so to speak. Something you would love to infect people with.
Understanding.
Understanding, that's a good one. Because I think most of us can understand why you chose that one, right? Because
Yeah.
we could
Because
all
we're so
use a little
misunderstood.
understanding. Okay. So now detect. Detect is if you can have a home test, like say a good example is like a home pregnancy test where you do a simple little test and it comes out yes or no. If you
Mhm.
can come up with that for like one specific disease or condition, whatever. It could even be CRPS if you want. But a simple home test that anybody could take that would just be like, boom, yes, you have it or no, you don't.
Um, Probably cancer.
Okay, that's a good one. Now, because cancer I think is kind of a common one, what cancer would you choose?
Oh, geez.
I just made it hard, huh?
Why didn't you give me these questions like 2 weeks ago when you asked me to do this?
Oh, it's got to be on the spot. On the spot.
Or why couldn't this be a drinking game?
That would be a good one, maybe. Yeah.
Let's see. What kind?
Okay. How about we'll skip that. We'll go to the next one because you
Okay.
might pick a similar one then for this, for the
Hmm.
cure. If you could come up with a cure for anything out there, any disease, what would you cure? And it wouldn't mean like everyone would be cured automatically, but there was an option to be cured and it would be gone for good.
Alzheimer's.
Okay. Okay. Do you know someone with
My
Alzheimer's?
grandma just passed.
Oh, wow. Okay.
My father-in-law has it.
Wow. Yeah, we did the 23andMe test, and Megan actually shows she has one of the variants for it. So we're
Oh,
like, oh,
this-
great. So that's
especially for Megan.
huh?
Said especially for Megan.
Yeah, I know, right? She's got a hard time as it is. Oh, well, that's a good one. I like that. Um, all right. Well, how about so that was the game. That's I won't make you answer the cancer part of it, okay? Because
Okay.
I know that's a lot of pressure. But any advice you might have for anyone who has RSD? Maybe they were newly diagnosed and something they don't know yet that they haven't heard. What would you tell them?
It's hard. And it's going to be hard until you can grieve your life pre-RSD and accept the new life that you've been given.
That's a good one. I mean, you said that to me too, and it's hard. You know, like I said, I don't know if I'll ever fully be able to let go, but you have to accept your new life.
Yeah.
I saw a kitty.
Yeah. You have to embrace your new life. You
Yeah.
know, it's horrible and it's called the suicide disease for a reason. But there are so many things in my life now that would never have happened if I didn't get it.
Yeah. Yeah. It's
So
amazing how things work out. So,
yeah.
and what about advice to anyone who might know somebody with RSD, but they don't know much about it? What can you tell them to kind of help them understand a little better?
You know, don't don't judge them. You know, when they say they're hurting, they're hurting. Their pain tolerance is so much higher than what yours is.
Yeah.
You know, this is a daily battle. I don't know if you've ever heard of the spoon theory.
The
Have you?
spoon theory?
Yeah.
I don't think so.
Okay. So basically, every day, people with a disease such as ours, we're given 10 spoons a day. Every action you do, you have to give up 1 spoon. How many things can you do in a day before you're out of spoons?
I think I've heard something similar to that. Yeah. So,
You know, getting up out of bed, that takes one. Getting dressed, taking a shower, making a meal. That's
yeah.
already half the spoons for the day, so you have to pace yourself.
Mm-hmm.
You know, we still want to live, and we might put on a great front that we're okay one day, but you know, just that trip to the mall or to the movies could put us on our ass for a week.
100%. Yep. You know, and the thing I explain to people, because they say I don't look like him in pain, you know, I'll tell them, I'll say, well, look, it's been almost 7 years. Do you want me to cry every single day? Do you want
Yep.
me to whine and bitch and moan about it nonstop? No, we have to learn to accept this pain and mask
Yeah,
it in a way. So, yeah.
exactly.
Yeah, no doubt. Well, I think that was pretty good. Lots of good info. You have lots of good insight. I really appreciate it. Is there any shout outs or anything you want to say? Anybody you want to say hi to or
And let's see. I'll give a shout out to Dr. Leveroni. He's the one who gave me my life back.
there you go. I like that. Cool. All right. Well, if you have any social media or anything you want people to contact you on, I can put that in the
Okay.
description below. And
All right.
that way, if people want to reach out to you or be in contact with you.
Okay.
So cool. All right. Well, thanks for being on. Stick around. I'm going to talk to you a little bit after we
Okay.
record here. But all right. Well, thanks for being on.
You're welcome.
All right. Peace.
You'll have to